So I'm just going to introduce myself. I'm Kelsey. I'm one of the nurses at Genesis. I do diabetes education. I'm one of the certified diabetes educators. So I've been with Genesis for about 6 years. I've been with diabetes education actually 4 years, like tomorrow. So I just realized it was my anniversary day tomorrow. So um, a little bit about myself. I have a 6-year-old and a 2.5-year-old. They keep me very, very busy. I also have, my husband, he actually has type 1 diabetes. So I kind of relate a lot back to him because I see what he goes through personally. So I'm able to kind of relate that back to my patients. So that's a little bit about myself. Today, we're just going to kind of go through some basics of diabetes and touch on a little bit of the meal planning. And we're going to talk about how we can control it and things like that. So we'll go ahead and get started. So what is diabetes? I know we hear that term a lot of, diabetes this, and there's commercials about how do we treat it and all these different medications. But diabetes itself is a disease that's caused by your pancreas, which is my little pancreas buddy here. And your pancreas actually gets damaged at some point in time. When that happens, your pancreas actually isn't producing enough insulin to bring your blood sugars fully down. So insulin's a hormone that will actually go to your red blood cells, which are these here, and they're going to actually open up the door to your red blood cell and let your sugar go inside. And then once your sugar's inside of this cell, it'll actually be converted to energy. And that's actually how you get energy to go about your day. So when you have diabetes, it just means that you're not producing enough insulin to fully bring your blood sugars into that cell. So you may have symptoms of like tired, worn out, lack of energy, that kind of thing, because your body isn't fully converting all that sugar to energy. It does affect the entire body, especially if it's uncontrolled. So it's just like, your blood goes literally everywhere. So when you have extra sugar on the outside of this red blood cell, this cell is going to literally flow all throughout your entire body. So when that happens, it can cause complications throughout your entire body as well. So it can cause things like cardiovascular problems, like heart attacks, strokes. It can affect your nerves and vessels and arteries and veins in the circulatory system. It can cause problems with your eyesight. So it can actually cause damage to your eyes, like spots in your vision, blurry vision, or total blindness. And these are kind of some things that we'll also talk about here in a few slides. But it can cause kidney failure, and then it also can affect your nervous system. And like I said, we'll talk more about that here in a few minutes, but it really does affect your entire body system. Let me switch slides. So this is where I was going to, said we were going to talk about here in a second. These are the complications that can come from uncontrolled diabetes. The biggest ones are really, our eyes, kidneys, heart attacks, strokes, neuropathy, that kind of thing. But we'll start at the top, our brain and cerebral circulation. This is where when your sugar is on the outside of your cell, it can actually increase the risk for clots, which would increase the risk for heart attacks or strokes if we're thinking of the brain. So when you get these that clump together, they're going to eventually cause a clot if you have a bunch of them clumping together. Symptoms of a stroke is that acronym BFAST, which is where if you go through that BFAST acronym, it's B is for balance. So if you're kind of walking like you're drunk, probably not the best term, but kind of falling a lot off balance. E is for eyes, if you have like a sudden right-sided or left-sided vision loss or vision changes. F is for face, if you have a facial droop, you have them smile, they're only one side smiles. A is for arms, so if you hold your arms up, you've got one kind of drifting. And then I lost my train of thought, so sorry. S is for speech, so my speech just went way out of whack right there. But speech would be if you're kind of talking garbled or you can't really make out what the person's trying to say, or maybe the person you yourself are trying to say remote, but instead it comes out black or paper or something along, you see paper, but you're trying to say remote. Your brain literally cannot find the word. Same thing, pen. I usually use the pen. Pen, you would say like right or blue or black or something like that, trying to think of pen, but it doesn't come out. And then T is for time. So if you have any of those symptoms, we want you to get treatment as soon as possible. They always say time is tissue, so we really want to get in as soon as we can to prevent any long-term complications and get treatment options that can only be given during that time period. So that's the brain. The eyes, diabetes can actually build up in the back of your eye, so the blood sugars can actually start to cause tearing and bulging and bleeding back there. It can, start out with some blurry vision, and then eventually it starts to lead to some retinal detachment, some bulging, which could potentially lead to like floaters almost. It's like spots in your vision. And then eventually it could lead to the total blindness. So getting your eyes checked at least once a year is very, very important. And that includes getting that dilated eye exam as well. Heart and circulatory system. So this would be like heart disease. This is my little model here. So when you have high cholesterol or like a circulatory problem, it's going to have trouble for that blood flow to get to where it needs to go. So if you can see here, I've got a clot forming over here. Now this is focusing more on cholesterol. However, this is the same thing that would happen if you had a clot form just from diabetes related. It would mean that that clot would form here, and then no blood flow would be able to get up to this area here. So that would, like I said, cause a heart attack or a stroke, depending on where that happened at. So speaking of the heart and your coronary system, cholesterol is also something that we really want to keep a close eye on with diabetes, because when you have cholesterol plus diabetes, it's just going to drastically increase that risk for heart disease and strokes, because it's almost like having two stickier surfaces. The cholesterol is sticky, and those cells can get sticky from that extra sugar, so they can clump together even easier and cause that clot to form even quicker. So cholesterol checked at least once a year, just to make sure all of those are okay. And we want to manage our cholesterol with, low fat, low sodium, low cholesterol type diets. Exercise can really help with that as well. And those kinds of things can also help with the diabetes process. Kidneys is the next one. So, and I'm talking about all the bad stuff first. Kidneys is something that can be impacted. It's called nephropathy, which is where those higher blood sugars are actually going to cause damage to the nephrons or filtering system in your kidney. So what happens is things that are supposed to go back into your body are actually going to start getting peed out. So like protein and potassium and calcium and electrolytes like that, we want it to go back into your body. But if your kidneys are damaged, your body's actually going to start missing those things, and it's going to start peeing out the things that we actually want back in our body. So we actually check a urine test to look for microscopic protein in your urine, and that's an early sign of any sign of kidney failure. So we do want to make sure that that's a very important test to have done, because unfortunately kidney disease is a silent disease. You don't have symptoms of it until it's in very late stages, and it's very important to get it tracked earlier so we can prevent it from getting to that point. Vascular problems or neuropathy, diabetic foot, these are all things where the circulation and the nerves and arteries in your feet start to deteriorate from the high blood sugars. And all of these things that I'm talking about, they are long-term complications. So that means that, if you're first diagnosed and you're like, oh my gosh, my sugars are really, really high, I'm going to have all these things happen. Diabetes is something that's very, very manageable. We can get it down and we can prevent all of these things from happening. It's just doing the work and putting in the time to get it down. But if we just let it go and forget about it, that's when these things will start to happen down the line. But back to the feet, it's something called neuropathy, which is numbness, tingling, burning sensation, slower wound healing, if I can talk. These are all things that can happen. This is probably the most common complication. And I usually bring my nasty foot And I do apologize, I forgot it. That's a bummer because I like to bring that one. But that's okay. So what happens is some people can get like something as simple as a splinter, or a blister or something minor like that. And then with diabetes and the neuropathy or the peripheral vascular disease, it makes that wound very, very hard to heal. So infection starts to set in, and unfortunately, infections are a stress on the body, so they make your sugars go higher. So it's kind of like a vicious cycle. So prevention is key, but those infections that can set in can actually lead to something called gangrene or necrotic tissue, which is where part of that portion of your foot or wherever this happens at can actually start to die. And that would mean that you would need an amputation. Um, like I said, that is probably the most common complication that I see as an educator, is problems with your feet. So we really want really good foot checks at least once a day. Look over your feet completely, bottoms in between toes, everything. Wear shoes at all times. That way you're not stepping on anything or stubbing your toe or something like that. And then we do want to have a provider check your feet at least once a year. So it could be your doctor, your endocrinologist. It could even be a foot doctor. So if you have neuropathy or problems with your feet, you can see a podiatrist, which is a foot doctor. Do we have any questions so far? That was kind of a lot, wasn't it? Okay, and everything that I'm going over in these PowerPoints is in these handouts that I gave you guys. I'm just not following the handouts. I just wanted to make sure you guys had something to take home with you. Let me move on here. So there is two different types of diabetes. There's actually three, but there's two main types of diabetes. There's type 1 and type 2. So type 1 diabetes is actually considered a viral or autoimmune disorder. This means that this pancreas, out of nowhere, just completely shuts down. It can happen over weeks or a month's time, but it's usually pretty quickly. It means that your body actually produces antibodies that will come and attack your pancreas and cause it to lose function. So when that happens, they no longer are producing insulin, so they're no longer able to bring those sugars down. So they have to be on lifelong insulin injections to help monitor and control their diabetes for the rest of their lives. It is something that's usually diagnosed in early childhood. However, that's not the case anymore. It's usually diagnosed more frequently in like 30s, 40s. I've had 60-year-olds. I've actually even had a 95-year-old diagnosed with type 1. So it really just depends on the person. They can do specialized testing for it to check for it, but it is something that does require the lifelong insulin. So things like pills or once weekly injections actually won't work for people with type 1. Type 2 is actually caused by lots of risk factors. And these risk factors are things like age over 45, sedentary lifestyle, being overweight, genetics or family history is a big one. Gestational diabetes, which we're going to get to that in just a second. Those all increase the risk for developing type 2 diabetes. So with type 2 diabetes, it just means that your body slowly starts to lose function of your pancreas. A lot of times it's a very gradual thing. So people might have something called pre-diabetes for a very long time before it even gets to that diabetes point, because their pancreas is just slowly losing more and more function. A lot of times people don't have any symptoms either because their body slowly adapts to it because it's such a slow progression as well. This one is usually, it can be diagnosed at any age at all. I've seen children with it. I've seen elderly, 20s, 30s, both types. It really doesn't discriminate on age anymore, because the testing has become so much better, the more technology advances. But type 2 can be treated with oral medications, once weekly injections. Diet and exercise can control it for some people. And then insulin is also a treatment option for type 2 as well. So that's the two main different types. Really, the biggest difference between the two is how it happens in your body. So, like I said, one is the autoimmune disorder, and one is caused by the risk factors, and then how you're treated with it. So, one is only insulin, the other one has all of those other treatment options like diet, exercise, oral medications, once weekly injections, or the insulin therapy. Just real quickly, the gestational diabetes is actually only diabetes during pregnancy. It's where the mom's body can't really keep up with the demands of the pregnancy. So insulin is a hormone. So the hormones during pregnancy kind of go crazy, and insulin's one of them. So unfortunately, insulin isn't something that can keep up with the pregnancy sometimes. So the mom's blood sugars tend to be a little bit higher while she's pregnant if she has gestational diabetes. And then that can impact the baby, and the baby can have complications once the baby's born. But after the baby's born, mom's blood sugars will usually go right back to normal. If they don't, it does actually convert to type 2 diabetes. And however, gestational diabetes also increases the risk for type 2 diabetes over the next 10 to 15 years. So people that have this, we do highly encourage getting yearly checks to make sure that they're not developing this early on. Questions so far?
Is it possible to go from type 1 or type 2 to type 1?
No, that's a good question though. I actually get that a lot. So the reason why is because, and I don't know if you've heard her with the mask, but is it possible to go from type 2 to type 1? And I get that question a lot because when somebody has type 2 diabetes, sometimes they may end up on insulin. And they say, okay, I take insulin now, that means my pancreas is probably not working, at least not at full capacity because I have to replace it. Does that mean I'm type 1? And the answer is no. And that's because of how it happens in your body in the first place. So one, like I said, is caused by that autoimmune disorder. So it means that those antibodies attack that pancreas. And the other side is the type 2, where it's caused by those risk factors that slowly damage that pancreas to where it needs insulin. So does that answer? Yeah.
Is gestational diabetes really common?
Yes.
Is there a way to test for it?
Yes.
Early?
So every single pregnant person now gets tested for it around the 28-week mark. It is actually quite common, especially now that they're testing every single pregnant person with it. But they're also very, very strict with those guidelines because they want to protect mom and baby. They want to make sure everybody's safe and has a safe delivery and baby does okay after birth. But they do something called a glucose tolerance test, which is where they'll go in, they'll do a 1 hour one first, they'll drink this gross drink. I had to do it with both my kids. It's literally like syrup, it's so gross. But then they check their sugar an hour after to see how their body processed that. If they fail that one, then they'll do something called a 3-hour test, which is another drink that's usually stronger. Again, had to do it with my son, absolutely horrible. I can never drink orange pop ever again because of this test. But they do that, and then they test it every hour for 3 hours, just to see how your body reacts to that sugar content. And then if they fail 4 of those tests by 2 points, or I'm sorry, by 1 point on 2 of the tests, they would be considered the gestational diabetes. So good questions. Any other questions so far? Okay. I already kind of went over this, but this is kind of what happens when you put food into your body breaks it down into sugar. Carbohydrates is actually breaks down into sugar in our body, and we'll kind of touch on the meal part in a little bit. But then it's supposed to go to your cells, and your cells will open up because of the insulin. Insulin goes to the cell, opens it up, and lets the blood sugars go inside, and that's where you get energy. The liver is a really interesting topic to talk about. Not so much interesting, it's just a little fact. But the liver actually stores sugar. So if you go longer than 4 to 5 hours without eating something, so this includes bedtime, your liver can actually push out blood sugars or sugar, which could in turn make your sugars go higher. So a lot of times when this happens, people are like, I haven't ate anything all day. I don't understand why my sugar is doing what it's doing. And it's because you didn't eat. That's why your sugar is higher, because that liver will actually say, oh my gosh, I haven't gotten any nutrients today. I need to push out sugar because I'm starving. You're not actually starving. The liver is dramatic, but it still does it because it thinks it's supposed to. So when that happens, you actually in turn have higher blood sugars. So when I get patients like that are like, I don't eat anything all day, I'm like, you have to eat, because eating regularly can not only prevent you from going low, because that's a risk as well, but it also prevents that liver from pushing out sugar, which would make you go higher. Questions on that? Yeah, we don't necessarily recommend the fasting, like the keto diets or like the long-term fastings. Like I know there's some fastings where it's like 16/8 or like 24 hours on, like those types of things. We always say, try it, see how it works for you. But the dietitians will usually say, let's try try that, because it could cause you to go into something called diabetic ketoacidosis if your body starts to produce ketones. And that's where, when your sugars are high, it's fighting for energy. So it starts to break down your fat for energy, and that fat breaks down into acid, and that acid can make you very sick. So they usually try and stay away from those diets, but we always say, everybody's different. It may work for you, it may not, but just be very, very cautious with it and keep a very close eye on your blood sugars. Any other questions so far? Okay. These are all symptoms of high blood sugars. So needing to go to the bathroom all the time, feeling very, very thirsty, having a lot of hunger, or maybe feeling like you can never get full. You can eat a big meal and then you're like, oh my gosh, I'm still hungry, like a half an hour later. Having some weight loss. Unexplained weight loss is really more for type 1, but it can happen for type 2 as well. Being really tired all the time, so just having lack of energy, just sleeping all night and waking up and still feeling tired. Blurred vision, having infections or sores that you can't get to heal very well, having some tingling sensation, or having red, swollen, or sensitive gums. I will say a lot of people, unfortunately, don't have symptoms of diabetes. Or if they do, they can explain it by other things. So they can say, oh, I'm really, really thirsty today, but maybe I'm just dehydrated. Or maybe they'll say, okay, well, I'm really, really tired, but I'm just not sleeping very well. Or, oh, my vision's getting worse. I have blurry vision, but maybe I just need new glasses. Maybe it's just time to get into the eye doctor. Really, most of these things on here, you can't explain by a lot of other things. So that's usually what happens is I go into somebody's room and I'm like, hey, you were just diagnosed with diabetes. These are all the symptoms. And they're like, oh my gosh, I've actually been feeling that way for a really long time. And it's because it never really clicks. They don't realize that it's a problem until it's like, oh yeah, I have been feeling this way. But once you know the symptoms, if you feel like extra thirsty one day, or you're having some vision changes, or you're just noticing that you're just not feeling right, definitely talk to your doctor about it, because you may need tested for diabetes, or you may need medication changes if you are having high blood sugars than what you normally are. This is kind of going over the same symptoms. Usually type 1 and type 2 has pretty much the same symptoms when they're first diagnosed, except type 1 may have some nausea or vomiting. They may get a kind of a fruity smelling breath, which is kind of strange, but it happens. I've smelled it. And then they can have the weight loss, but everything else is pretty much the same symptoms. And the nausea, vomiting, and that fruity smelling breath is caused by that diabetic ketoacidosis, which is where their body's basically breaking down their fat to acid, and that acid makes them very sick, and those are the symptoms of that. Risk factors. There is lots of risk factors for diabetes. I talked about most of them already, as in the sedentary lifestyle, being overweight, age over 45, Ethnicity is a big one. Family history and genetics plays a huge role in diabetes. Having gestational diabetes in the past, and then high blood pressure, having a lower HDL, which is the good cholesterol, or just having abnormal cholesterol levels in general can increase your risk for diabetes. These are just some tips and tricks for managing diabetes. We do recommend wearing a medical ID alert bracelet, especially if you take insulin or if you have a risk for low blood sugars. A Glucagon Emergency Kit is highly recommended for anybody that takes insulin. What this is it's something that a loved one can give you if you pass out from a low blood sugar. So a friend, family member, whoever can give this to you if that comes to an emergency event. Keep your blood sugar clean and use it appropriately. With that, make sure you don't keep it in the car where it can get too hot or too cold. That can damage the supplies. Keep those strips in that little bottle because that can damage them as well if you take them out and leave them out. Make sure you're going to your yearly appointments, like your eye exam, getting all your yearly tests, labs, that kind of stuff. Go to your doctor's visit as scheduled. Stay up to date on your immunizations. I usually butcher that, so I'm really happy I said that without an itch. Take really, really good care of feet. I'm a huge stickler on foot care because, like I said, it is a very common complication. So check your feet, check your feet, check your feet. Stress is a big one. So a lot of times we don't necessarily realize that stress can impact our blood sugars, but it really can. It can be anything from being stressed out from work, everyday life, family, friends, coworkers, finances, literally whatever life throws your way, stress can really, impact your blood sugars. So we definitely want to do things to help manage our stress in a healthy manner. So doing things that you enjoy, relaxation techniques, maybe it's reading a book, watching a movie, going out for a walk, sitting outside, playing with your kids, I don't know. Whatever you like to do to relax, definitely try and get that in to kind of de-stress and help that stress level come down. I always say mental health is just as important as your physical health because it really does impact your overall physical problems like your diabetes, blood pressure, things like that. It can have a direct impact on those things. Sleeping can also impact your diabetes, so make sure you're getting a good night's rest. If not, if you're having trouble sleeping, talk to your doctors. On the flip side of stress, it can also be a physical stress on your body. So if you ever get sick, have any pain, if you have like allergies, cold, an earache, if you get a surgery, a procedure. My husband actually got stung by a bee, and that made his blood sugars go higher because it was a stress on his body. He had kind of an allergic reaction happen and made his sugars go crazy. So any kind of physical stress on your body can definitely impact your blood sugars. So that's kind of what I say, if you check your sugar and it's high and you're like, well, my diet's the same. I haven't really changed anything with that. You really do have to look at that whole picture. Ask yourself, okay, am I stressed out? Did I get in an argument with someone? Am I having anxiety about something? Is something overwhelming me? Think about, am I sick? Do I have allergies? Do I have any pain anywhere? Same thing with if you're sleeping, just your movement. See if you, ask yourself, well, was I as active as I am normally? And am I not being as active because maybe I don't feel very good? Try to think about all those things because all of those things can impact your blood sugars. It's not just what we're eating. Questions so far? No, keep asking that. Yeah.
Where do you get the tag or the bracelet to wear?
So you can get this. Honestly, the cheapest I've seen them has been Amazon.
Okay.
But you can get them at any pharmacy. I've seen Northside carry them. Walmart, I've seen them have them. They're kind of in the jewelry section.
Okay.
But Amazon has a whole bunch of varieties. I've seen some fancy ones on that Etsy site. I don't know if you know what that is, but it's kind of like a crafting site. But really, any pharmacy, if you're wanting to get one local, they do carry them.
Okay.
question though. Activity can really help manage our diabetes. When we're physically active, our muscles will actually use up that extra sugar content, so it's really going to help naturally lower our blood sugars. You're also sweating, so you're going to sweat out extra blood sugars as well. Fiber can help attach to that extra sugar and get rid of it easier. Whole grains is healthier. Losing weight is a big one. That can really help open up our cells in our pancreas to pushing out more insulin and opening up that door that I talked about, so the insulin can attach and let those blood sugars go inside. And of course, all of the other benefits from weight loss, like better cholesterol levels, better blood pressure, our joints, that kind of thing. And then just overall make healthier choices. If you're at a restaurant and you are getting a meal and you have the option of fried chicken or grilled chicken, just choosing healthier things like getting the grilled chicken instead of the fried. Or with exercise, maybe it's a nicer day out, you're like, okay, I'm gonna park farther away in the parking lot and get those extra steps in. Or just like today when we were coming here, it was an option to take the elevator and I said, no, let's go ahead and take the stairs. Just things like that to make healthier choices overall can really have a big impact on your overall health. Smoking, we definitely want to quit smoking if we smoke. Smoking can actually increase the risk for all of those complications that I talked about previously. So if you need help with it, definitely speak with your provider because there's resources out there to help with that. I already kind of talked a little bit about weight. Weight loss is not easy. I will be the first to admit that. It's not easy at all. It's very easy to put on the weight. It's very hard to get off the weight. The biggest thing that I highly recommend with weight loss is just trying to stick to a routine. So whether it's exercise or a diet, things like that, don't do drastic changes, like drastic diets where you cut out everything. A lot of times we don't necessarily stick to those types of things because they're not realistic. So we got to do baby steps and really try to stick with it. But exercise really is a big part in that. Diet can only play so much of a role, but we got to get our bodies moving. We got to get those muscles to get stronger so they can help get rid of that fat content. I'm going to kind of skip over this waist circumference. I do recommend that if you're trying to lose weight, go ahead and measure yourself before. Because sometimes you may not necessarily see numbers on the scale come down, but if you're measuring yourself, you can actually see that number around your waist, your arms, your legs. That might start to change, and that just means that your body is gaining muscle and it's really getting healthier overall. We want to make sure that we're eating good food choices. So we want to watch out for things with like added sugars, and we want to watch carbohydrates and things like that, which I think is the next slide. Yes. So we want to get, shop the perimeter of the store. So when we go into a grocery store, usually the healthier options are on the perimeter. So that can really help you choose those healthier options overall. Getting some leaner proteins, that's actually going to play more into our heart content or our heart health. So we want to make sure that we're choosing leaner meats, cutting the fats off of meats, preparing them in a healthier manner, so not frying them or adding breading or anything like that, just baking them and grilling, that kind of thing. We do want to add a wide variety with each meal, so getting your vegetables, your fruits, your protein, your carbohydrates even, just getting an overall balanced diet. Carbohydrates is one of the biggest things that we do want to watch with diabetes because it does have that component where it breaks down into sugar in our body. So carbohydrates are going to be things like your fruits, starches like your breads, pastas, cereals, potatoes, rice, oats, beans, things like that. And then your milk products is also another thing that we want to watch portions of. Milk actually has natural sugar in it. It's got lactose, so we want to, watch those hidden sugars like that, lactose and fructose and those kinds of things in milks and fruits. We want to watch added sugars. So regular pop is a really big thing that we do highly encourage that you cut out. This is how much sugar is in regular pop. So this is Sierra Mist, and this is Mountain Dew. Amy? This is how much sugar's in it. But yeah, so this. Huh?
Hers has double.
Probably. So if you're really thinking about it, if you drink this whole bottle, this is how much sugar you're putting into your system. Sierra Mist has a little more than Mountain Dew would, but it's just unnecessary added sugars that our body doesn't need. So things like regular pops, the sweets, trying to get products that don't have a lot of added sugars in them. This is a diet. So as you can see, diets have nothing in it. Obviously, water is the healthiest option, but when it comes to pop or soda, whatever you want to call it, diet or zeros are the better option because there's not all that added sugar that's in the regular pops. Looking at food labels is very, very important. We want to try to get things with as little added sugars as possible. Sugar-free options are great. However, you still have to look at the label because it may still have things called sugar alcohols and carbohydrates in it that could still break down into sugar in your body. So looking at food labels is highly important just to make sure that we're not, missing things and it's mislabeled or misleading information. Questions so far?
When you're talking about the different foods, carbohydrates, and vegetables, proteins, do you recommend like a portion plate
Yeah.
to help until you get a good understanding?
Yeah, that could really help. Even breaking out like the measuring spoons to really, measure out what a portion on that label would actually say if you don't have a portion plate. But yeah, portion plates are great. They literally, it's a plate that portions out exactly how much of each food group you can have. And until your eyes adjust to that and get used to that amount of food, I do highly recommend either measuring it out yourself or getting one of those portion plates.
Because we did a thing in Crooksville a couple years ago, which was about diabetic awareness, and they gave us a portion plate, and half of it was vegetables.
Yeah.
And I thought half of it should be protein, but it was completely opposite when it was divided. For the others.
Yeah, and protein is a big one that most people don't realize, but protein mainly affects your heart. So we still have to watch portions of the protein because of the fat and cholesterol and sodium content and that kind of thing that could impact our heart and cholesterol levels and that kind of thing. But yeah, portion plates are great. I highly recommend them if you can find one. Usually you can order them. They have great, things online and stuff like that.
But that was good at helping weight control.
Oh yes.
Also using the portion plate. And it, like I said, until you get your mind reworked for using those portions, it is a very good, helpful tool to use that.
Yeah, because your eyes are a big impactor of I feel like they're linked between your eyes and stomach because if you put a regular portion on a big plate, it looks like a very, very small amount. But if you put that same portion on a portion controlled plate or a smaller plate, it looks like you're getting a good bit of food.
It's actually perfect.
Yes. So we do recommend, getting smaller plates, not having a big rim around them because that's where our eyes start to play tricks and it's like, I'm not getting very much. I need to have my plate completely full. So yeah, those are just a little bit of tips and tricks to kind of help manage portions.
I have a question.
Yeah.
So I heard you mention beans. So that's not a good thing.
So it's something that we want to watch portions of.
Because why I asked is because I made turkey chili and I thought I was doing a good thing. And then, you had mentioned beans in there and it's like, oh.
Yeah.
I didn't even think about it. I thought it would be,
Yeah,
Good.
and they are healthier for you. They have a lot of fiber, a lot of nutrients in them. But they have a lot of starch, and starch is a carbohydrate. So we do want to watch portions of them. So
Okay.
as long as you didn't have a huge helping of it, or maybe, 2 bowls instead of just like one regular size bowl, that is perfectly fine. And
Okay.
turkey is definitely a great option. It's very, low in sodium, low in fat content. It's a leaner type meat. So definitely sounds like you're on the right track. It's
We're
just,
dry.
yeah, it's just portion control with those types of things.
Okay.
But yeah, you do not have to cut beans out. It's just, like I said, just smaller amounts of them.
All right.
Good question. Where do we begin? So if we feel like we have trouble with diabetes, first we got to go to our doctor. We got to get tested for it. We need to see where we're at, get a good game plan, get on a medication if needed. But then the next step, we do have a really great program at our diabetes education department. We have dietitians, registered nurses, where we can really work one-on-one with you, get you on a good plan and program to help learn and overcome those barriers and learn exactly what to do, when to do it, that kind of thing. Reading labels is very important. Like I said, we want to look for those, hidden sugars. We want to see how much carbohydrates, but we also want to see the serving size as well. We grow up thinking that a can of soup is, you eat the whole can, but it's actually not a whole can. They're in that serving size. So it's little things like that that we just kind of tend to overlook and get on a habit of it. But really getting back to those food labels is very important. Planning meals is great too, because it tends to limit us from choosing unhealthy options, or I'm guilty about this sometimes. I won't plan. I usually actually do plan my meals out for the whole week, but sometimes, life gets ahead of you and you forget. And then that night comes and you're like, I'm not cooking, just throw something in. And it's usually not a healthy option, or let's order pizza. Not healthy options at all. So it really does mean that, when you plan meals, you do get a healthier outcome than if you just kind of get to that day and you're like, I don't know what to cook. I'm just going to throw something together, or, throw something from the freezer in, or something like that. Yeah.
So you actually like plan your whole meal, like
Mainly just like the main dishes. Like I'll do like chicken. Like I do a lot of like grilled chicken, or like air fried chicken. I love my air fryer. So I'll do that. Like I'll just put that on there, and then I'll prepare it, usually just with, like, seasonings and stuff. Or like last night we had, like, I'll just put like the main thing. Like we made chili one night, and I'll just like write that out, like the main thing. I don't normally do sides, but it's just kind of like an idea. But I mean, if you could most certainly plan out your sides as well, because that could be tricky too. If you're trying to think, oh, I don't have a side, let me just throw a can of corn in. Well, corn is a starch, so we got to kind of watch portions of that. If we're also having like a potato or some kind of bread with it or something like that.
ideas.
It's also better to eat fresh instead of canned,
Oh yes,
because the cans have a lot of added
yeah,
salt. And
Yeah.
Frozen is good too, right?
yeah. Frozen's usually better than canned as well. Fresh is usually the best, because it doesn't have those added preservatives and added things. But yeah, frozen is a pretty good option as well. But canned foods do have a lot of sodium in them that could be hidden in some areas.
What's your tips on chicken and air fryer?
Yes.
Never done raw chicken in an air fryer.
Oh, I love it. It's so easy. I literally just throw it in for like 25 minutes, sometimes 15 if they're smaller, and it comes out so juicy. If they're bigger, I do flip it halfway through though. So, but
Like the highest or like 350?
I usually do like 400. Yeah, I love it. It's my favorite thing. It's so easy. You just throw it in and go. Okay, I think we're about done here. Find out what your targets and goals are. That's a big one. Goal setting is huge, because you need to know what you're aiming for. So whether it's a weight loss goal, an A1c goal, a blood pressure goal, blood sugar goal, maybe it's exercise. But the first thing is establishing those goals. So trying to figure out, okay, what is the number one first thing that I want to work on. Setting that goal, setting a timeline, and also make it realistic, and then achieving that goal and maybe then moving on to the second one. A lot of times when we try to work on a whole bunch of goals at one time, it gets very overwhelming and it can get very discouraging if you're not meeting the goals like you feel like you should. So I do recommend picking one, maybe two, if they kind of go together. Focus on those, master those, and then move on to the next goal. Having a good support system, asking for help when you need it, whether it's your spouse, your loved ones, your doctors, even us at the diabetes education department, we can be a good support system for you as well. So just learning who your support system is. The pharmacist is a great one that a lot of people forget about, but that is a good support to just go and say, hey, I want to start, I'm starting on this medication. Can it impact my diabetes? Or, hey, I need some cold medicine. What is best for somebody with diabetes? So also having that support system as well. Writing it down and place it where you can see it. This is great. I do recommend putting it like on the refrigerator or on the bathroom mirror, somewhere where you can remember it and it'll keep reminding you to keep track and to keep on, trying to get to that goal. Maybe your goal is exercise, and if you're like me, I don't like exercise. I know it's very, very important, and I do try and get it in pretty much every single day. But let me tell you, there's days where I can literally rattle off a million excuses of why I don't want to exercise. But I have to think of that one excuse of why I'm going to do it and focus all of my time and energy on that, and push out all of those negative thoughts of what I, don't want to do it for. And then honestly, after that, I feel great. I'm proud of myself for doing it. I had all those excuses to not do it. But the fact that I did it is almost like a pride moment where I'm like, hey, I actually can do this. I'm doing good. So it's just trying to focus on that positive feeling of it, but also putting it to where it's going to remind you. Mine, I literally have my treadmill in our bedroom. So that's a good reminder right there that it's literally right where I see it. And it's like, it's there. I got to do it. So it's just finding what works best for you.
Should you check your sugar before you exercise?
Yes, good point. So exercise is actually something that can lower your blood sugars. So we do want to check your sugar before and potentially afterwards if it's lower, just to make sure that your blood sugar is at an acceptable level to start exercising. If it's not, we do want you to, if it's low, we do want you to try and get something to eat or drink, like maybe half of a sports drink, a granola bar, something like that to help get it up to an acceptable level, preferably up to 120 or 130 or higher with exercise, because like I said, exercise is going to burn off that extra sugar, so it could drop it too low. So yes, good point. We do want to check it before, and then like I said, you can check it after as well, just to make sure it's still okay after you're done. And that could be motivation for you. Maybe you checked it before and it was high, and you exercised and it was low, lower after you were done, and it's like, hey, this actually works. I actually see changes. So it could be motivation for you to want to do it again. Okay. What other questions do you guys have for me? That's what I wanted to talk about today, but let's go through some questions.
Now, if you're type 2 and you don't test for your sugar, how do you know?
Just your symptoms. You really got to listen to your body. Shaky, sweaty, dizzy, lightheaded. Those are the main symptoms of a low blood sugar. The other ones are like confusion, feeling really, really tired all of a sudden, getting really hungry, those kinds of things.
So if you get that after you exercise, make sure you eat something.
Yes, we want to get about 15 grams of carbs, which is like 4 ounces of juice, a handful of, candy like Starburst or Skittles, some cake icing, a half a can of a pop. Glucose tablets are great as well. It's just straight sugar, so you can get those to keep around the house. We do need to eat like 3 to 4 of them, though, to bring up that low blood sugar. But I do highly recommend that if you are taking medication, talk to your doctor about potentially testing, because they may recommend it, especially if you're exercising. even if it's just testing while you exercise, just to make sure that you're not having that low blood sugar.
Okay.
Good question though. What other questions?
If you are doing the diet and the exercise, you're trying to lose weight, it's been my experience not to check the scale every day and only do it maybe once a week or once every 2 weeks. And usually first thing in the morning, not after you've eaten breakfast and things like that.
Yes.
You've already started the day. So, like I said, because you will get frustrated if you check it every day.
Oh, yes. I've done that. Yeah, I highly recommend at minimum once a week and make it around the same time each time, the same amount of clothing, same scale, just to try and make it as consistent as possible. Good point. What other questions? Yeah.
If you are pre-diabetic, is there a way to get out of that?
Yes.
Or you always-
Nope. So the only time that you're always with it is when you become a diabetic, when you cross that threshold into diabetes. Unfortunately, diabetes never goes away. You can control it and you can keep it well controlled and even normal numbers for the rest of your life. However, if you ever come off of that diet or become inactive again, or things happen in our lives where, our body changes, that diabetes can actually go right back up and that number would come up with it. But pre-diabetes, that's a point where we're like caution zone. It's like, okay, this is a time where I can do diet and exercise. I can get it down to normal numbers and keep it there forever. Now, sometimes it does start to creep back up. And then we're like, okay, we got to kick it into gear again, get it back down. But yes, you most certainly can get pre-diabetes reversed and keep it that way forever.
A1c numbers determinant of diabetes?
A1c and blood pressure or blood sugars are both numbers that they'll check. With it, the A1c, we want that to be less than 5.7 is normal, 5.7 to 6.4 is pre-diabetes, and then 6.5 or above is diabetes diagnosis. So they do really focus on that, but anything above 126 for blood sugar is considered diabetes. About 100 to 125 would be pre-diabetes ranges, but that blood sugar at that time is going to be what it's doing at that time, whereas that A1c is going to be a 3-month of the past averages of what your blood sugars have been running. So they kind of do both. They'll look at both numbers. What else? Good questions.
And then is it better to eat 3 big meals a day or 4 or 5 smaller meals a day?
We usually recommend, either one. It really just depends on the person. 6 smaller meals, maybe 3 meals and some snacks in between could be fine. If you're eating 3 bigger meals, of course, watching portions still and not, overdoing it. But really, the biggest thing is we recommend at least something every 4 to 5 hours apart. So that includes like a bedtime snack, breakfast, lunch, dinner, and maybe some snacks in between if it's longer than 4 to 5 hours apart. So that part, it's really just depending on the person, what they prefer. When I get people that are barely eating 1 meal a day, I'm not going to say you need to eat 6 meals a day. That's just too much. So we got to baby steps and ease them into it, but at least something every 4 to 5 hours apart. What else?
Can you have red meat?
So red meat, like with the protein and things like that, is more for your heart. Red meat is okay in moderation. So just, smaller portions. They say about a handful or about the size of a deck of cards is a good portion for red meat. Trimming the fat off is really important. But if you have heart disease, we do recommend trying to stay a little bit away from the red meat. Getting, chicken, fish, that kind of thing. But every now and then, if you want some red meat, it's okay, just not a whole bunch.
Yeah.
Yeah. What else? This is good.
I work for Genesis, and they have a very nice wellness program. And through that wellness, doing their steps and meeting with and talking with the dietitian, one of the things that I didn't even think about it, but we're trained to comfort ourselves with food a lot.
Mhm.
And I mean, right from a baby, the baby starts crying, the first thing you do is you stuff the bottle in its mouth.
Mhm.
They may not be hungry, they might be wet, they could be something else. But what's the
very
first thing they
true.
do? We step, you know, and I
Try
was
to
like,
feed
oh my
'em.
gosh, I did that to my kids, you know, when we're sitting down at dinner, what do? We fill their plates and we say, you have to eat everything on your plate.
Yeah.
You know what I'm saying? Instead of saying, Mom, I'm full,
Mhm.
we're looking at it from, no, that's on your plate, we need to eat it.
Yeah.
And so, I think that we almost have to change that culture.
Yeah.
And I didn't even, like I said, so sometimes it could be psychological. I eat more when I'm stressed.
Yeah.
And so.
Or like if you
literally-
see it on your plate, you're gonna want to eat it more than if it wasn't. Like if you need to get up and go get seconds, you're more likely to question yourself. Well, if it's all on your plate, you get a bigger serving. It's like, I need to finish all of this. It's here. I got to eat it. Because it is a psychological thing.
Sometimes, yeah. And I did think that when we did do that program down at Kirksville, the OSU SNAP Ed, the coordinator did this program down there that
Yeah.
they're putting on. And she had a great tip of putting a cup size, a cup like in your cereal box. Because a serving size, when we were pouring it in the bowl, because I love to have cereal at night or something like that, just, and so
Yeah.
I'm sure, yeah, yes, I had dinner, but you know what? Bowl of
Yeah.
or cherry honey nut Cheerios, something like that. But really, when we're dumping it in the bowl, I just do it to
Eyeball it.
eyeball it,
Mhm.
which I'm way off. And most people I think are, so I thought that was a great tip,
Yeah.
that we learned to do some of these little.
Mhm. And that's why when he mentioned the portion plates, that's not always ideal. We don't always have portion plates, but breaking out those measuring cups and actually looking at the label and seeing how much to have, or specifically counting out the number of crackers or pretzels that you can have. Because a lot of times, like you said, we'll eyeball it and we'll just dump out whatever we think is 15, and then we count it and it's actually like 25. So it takes those steps to really train your eyes and your mind to see what an actual appropriate portion is. But great tips. What else?
The hardest thing that we've had to deal with is that we eat for enjoyment.
Mm-hmm.
That's what we do. Like you go out and eat, you stop at Wits and get an ice cream or something. That's what made us happy.
Right.
And then, well, actually, he was the one diagnosed.
Okay.
And then, he's diagnosed with this, and then you get this whole list. You can't eat this, you can't eat that, you can't have this, and and then it's like,
low saturated fat
Yeah.
diet too, 10 grams or less a day.
yeah,
And then no
we're
sugar.
like, what do you eat?
Yeah. It makes it overwhelming, doesn't it?
Yeah.
Like I said, the biggest thing is portion control. If you're really craving an ice cream every now and then, go and get that ice cream. Don't get a big one, but get enough to curb that craving, and don't make it an all the time thing. But you have to make yourself happy too. I mean, you can't deny you of that, because then you're just going to keep wanting it. And when you finally do get it, you're going to splurge and you're going to eat a whole bunch. So we do recommend, those types of things. If you're really craving a candy bar, go get those little mini bite-sized candy bars, just enough to kind of get that taste and curb that craving, and then give the rest away, or, whatever it is, put it away to where you can't find it or something. But it is a lot at first when you're like, what am I supposed to eat? Honestly, when you have a specific diet like that, when your doctor's giving you all these different guidelines for saturated fat and cholesterol and carbohydrate, I do highly encourage people to meet with a dietitian, because they can individualize it. They can look at your diet, see what you were used to do, and then really tailor that to how we can make it a happier diet than cardboard and water. So I think that could really be beneficial. But like I said, the biggest thing is portion control and then moderation. That's just the nitty gritty of it.
Okay.
That's still saying.
Yeah.
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 That's our
How do
generation.
How do we go about getting is there this number that we can call?
I handed out some pamphlets here. It's the same number, but one is for diabetes and one is for the medical nutrition therapy. If you're interested in either of those programs, just call the number. I need to make sure. Yeah, same number. I was like, it better be the same number. But call that number on there. And we can get you set up. We can get referrals. We can get you scheduled, whatever it is we need.
And some insurance cover that.
Oh, yes. You're thinking of all the things. Yeah, we'll run your insurance benefits. So we'll check to make sure that it's covered. And if you have a cost, they'll let you know well before your appointment what that cost is. But Medicare and Medicaid do cover 3 visits for medical nutrition therapy. And they also cover our diabetes education program, which is a 10-hour program. So that's if you have diabetes, I should clarify that. So if you've been diagnosed, medical nutrition therapy has some other guidelines that I'm not familiar with, Amy. But diabetes is one of the covered diagnoses for both of those. All
Roughly,
right.
all right.
Well, I think that pretty much covers everything I wanted to talk about today. You guys all have our number, so just call us if you think of any other questions, if you want to schedule anything like